There is one organ which causes high blood pressure, and it's not what you think. And there are specific exercises you can use to target and fix your blood pressure easily. No diet, lifestyle changes, or medication required. Check the link in the description below, but for now, today's question.
The question, can high blood pressure be controlled without medication? Answer by Jovan Shawquick. Okay, most of these answers contain a grain of truth and a whole load of bollocks. First up, we can't answer your question without first determining that you have high blood pressure. Sadly enough, this depends on what country you're in. And not kidding me. European, UK, Australian and Japanese doctors will likely interpret the same blood pressure in a different way from the way US doctors now do. To read more, see, is there a problem regarding a 120/90 blood pressure? Whether you need medication also depends to a certain extent on how high your usual blood pressure is, assuming it's measured correctly, and how severe the complications are. It may be wise to talk to your doctor. Diets that work. There is little doubt that the DASH eating plan moderates salt restriction, and eating your vegetables is on its own quite good at reducing your BP. If you want to be more extreme, you can go back about 80 years, where they didn't have blood pressure lowering medicines. But be warned, although this may work, it's nasty, and has attracted some crazies. In the 1930s, Walter Kempner, a physician and refugee from the Nazis, shot any number of patients with malignant hypertension who were edging into kidney failure. He discovered that radically reducing salt intake produced amazing results within about 2 months. The problem was that the diet was mainly rice with some added vitamins and stuff. The salt content was truly minuscule, under half a gram of salt a day. He must have been very charismatic to get his patients to keep to the diet. Or perhaps being on the verge of death did it. We now believe that most people can manage on about a gram of salt a day, although the salt industry and their acolytes will vehemently disagree, and the average Western diet contains something like 1,015 grams per day. But you will struggle to cut back. All of the evidence points to the benefits of fairly substantial reductions in salt intake, and taking potassium in by eating your vegetables. You likely don't have to go to the Kempner extreme. Other things. As for a lot of the other suggestions, lowering cholesterol won't fix your blood pressure, nor will rock salt, drinking water, taking olive oil, eating black pepper, etc. If you exercise enough to sweat, there is good evidence that this will lower your blood pressure a bit. Perhaps you're just losing salt? There is some evidence that things like meditation lower blood pressure, but, as is often the case with alt-med, there is likely to be publication bias, and the way these studies were controlled was often less than rigorous. This is not a small problem. Why good trials are important and difficult. Allow me to illustrate how important controls and proper blinding is in evaluating the effects of a treatment for high blood pressure. I won't use an example from the alt-med literature. I'll use a treatment that in 2014 was poised to enter the mainstream and make billions for the company Medtronic. It all looked so promising. The backstory is this. Some enterprising doctors had come up with a cool idea. Zap the nerves that go to the kidneys, and it seemed that in about 1/3, high blood pressure was cured. No bells. They did 2 apparently solid trials, Simplicity 1 and Simplicity 2. That, at least in the short term, this worked. Or appeared to work. But then came Simplicity 3. 1. The difference here was that they used proper blinding. A sham procedure, a fake intervention, pretending to feed a catheter into the groin, was used in the control group, and lo and behold, there was no difference. The apparently good treatment turned out to be rubbish. Any study of any treatment for blood pressure needs meticulous design and execution. The bottom line, if you do indeed have substantially raised blood pressure, then cut down substantially on salt, eat your veg, and if you can't sustain this, then take the darn medication. And don't waste your time with anecdotal therapies that may just work. My 2C, Joe. Some diehards who invested heavily are still trying to punch renal denervation. But if Medtronic cancelled Simplicity 4, you can be pretty sure the evidence against it working was damning. The image of Kempner from Walter Kempner, Medspace, renal denervation from Renali Denervierum, Barum die Simplicity HTN3 Studi Geschichterdist. Footnotes. 1. A controlled trial of renal denervation for resistant hypertension, NE. Answer by Rahul Gupta. There are basically 2 types of medicines available to mankind. First is natural, for example vitamin A, B, C, D, E, calcium, iron, potassium. These chemicals were present millions years back in nature, and these are also present in a newborn baby. These are non-harming to human body most, 99.9% of the time. You should not fear such type of medicines. They are as good as or as bad as our food. Second are new synthetic chemicals made by man in laboratories, mostly petrochemical derivative drugs, for example paracetamol, which were not present in nature even today, and those are always harmful beyond your imagination to human body. You should stay away from such medicines. 8 lakh people die in USA every year due to prescription drugs medicines surgeries procedures hospital acquired infection. When taken according to doctor's advice and when taken as directed by doctors. Answer by J. Lawrence Dohan. Quite often, especially among younger people, exercise plus diet plus low sodium intake will produce better BP. Notice, though, that there are varieties of hypertension in different kinds of people. Therapeutic approach thus varies. Sometimes the person just needs to quit drinking alcohol. Sometimes the person needs to reduce stress, etc., etc.